Hello, my name is Sharon and I'm a nurse. You know, to err is human. 44,000 to 98,000 people die every year from medical errors. Some startling facts are that 1 in 7 patients will experience an adverse event while hospitalized. The annual cost of these errors is a startling $44 billion, not to mention the cost of human life. Can I tell you something even more shocking? 44% of these adverse events are preventable. It's called patient safety. Specifically, I want to talk to you about patient safety regarding medication reconciliation, and I would like to discuss with you legislation that I am proposing. Medication reconciliation is simply the process of avoiding inconsistencies across transitions of a patient's care by reviewing that patient's complete medication regimen. Unfortunately, in our current medical system, care is fragmented. And one of the biggest challenges in improving medication safety involves ensuring that accurate information about a patient's medications travels with that patient through systems and transitions of care. You know, electronic charting systems are not universal between doctors' offices and hospitals. That information does not flow freely. Medication errors are the most common of the errors that occur. The average patient is subject to at least one medication error per day. The results can be deadly. The solution that I'm proposing is a statewide database for prescription storage in the state of Florida. The system is quite simple and would be very similar to the prescription drug monitoring system that Florida already has in place called eForce. Legislation for eForce was passed in 2009, and it has been successful in minimizing drug abuse and diversion, and it's increased safer prescribing of controlled substances. I am proposing legislation now for a medication reconciliation system called MedRight to ensure that patients get the right medication 100% of the time. MedRight is an electronic database that's state-specific, similar to the Department of Motor Vehicles. In this database, providers would list medications and prescriptions that they prescribe to patients or are going to prescribe to patients. That information would then be stored in a database. And when patients are admitted to the hospital or they go to see a new provider, that system can be accessed with the patient's permission. Medication reconciliation is an intervention in the 5 Million Lives campaign. And both the Institute of Medicine and the Joint Commission on Accreditation of Healthcare have identified medication reconciliation as a priority. With MedRight, medication reconciliation and prescribing can be greatly facilitated and patients' lives can be saved.